Well, joining us now from Omaha, Nebraska is Dr. Jasmine Marcelin, an infectious disease physician at the University of Nebraska Medical Center. Thank you so much for joining us. And as a physician, how do you persuade people in communities of color who fear that they may be being experimented on by the government to take the coronavirus vaccine?
Well, thanks for having me, Laura. I think it's a really important discussion that we need to have with our patients. And one of the things that I like to emphasize is that the people who are expressing their concerns or need for deliberations, they're not a monolith. People have a lot of different reasons why they may be concerned. And so it's important to address each of the individual concerns as they come up. So the way that I like to do it is first just ask folks what are their thoughts in general about the vaccine. Have they given it any thought? And then sit back and listen to hear what it is that they have to say, and then ask, if they would like to have additional information. May I tell you a little bit more about this? And this is something that I think is really important for us to be able to sit with some of the discomfort as healthcare professionals that we may feel when our patients tell us that they have concerns.
Now that we're seeing more variants of the virus, including one here in New York City, is it more crucial than ever that people get vaccinated as it becomes this race between the variants and the vaccine?
Absolutely. We've seen over the last year how this virus, how COVID-19 has really ravaged the Black and brown communities across the United States. And we really don't want to see that replicate itself with increasing numbers of people becoming sick from new variants. And so it's really important for us to get folks vaccinated, because the sooner that we can get to what we would like to see as herd immunity, where more folks are not susceptible to the virus, the sooner that we can see that we're protected from the variants that are currently here or any others that may be developed in the future.
President Biden was marking 50 million vaccinations here in the U.S. today. But I must say that when I was in the Bronx talking especially to elderly people, they're finding it very hard to navigate an online sign-up system. How do you deal with that as a physician?
One of the things that we've been doing at one of our specialty care clinics here in Omaha is talking with our patients while they're in clinic with us and signing people up. If they are interested after having these conversations, we help them sign up right away in our clinic. And I think that is something that is really important for us to be able to do as healthcare professionals, to reach out to the folks who don't have that kind of access. I think it's important, as we're talking about mobile vaccination units not having enough vaccine supply, perhaps the mobile vaccination units can then be mobile sign-up units, and let's try to figure out how we can transport people to the vaccine administration sites if we don't have the supply yet, and then use that to build the momentum to be able to actually then bring those vaccines into the community when the supply increases.
Dr. Jasmine Marcelin, thanks so much for joining us there with those suggestions.